Hi everyone, today's video is on the topic Bell's palsy. What do you mean by Bell's palsy? Bell's palsy is the acute onset unilateral idiopathic lower motor neuron facial palsy. So, when you are asked what this Bell's palsy is, these are the points that you have to remember. That is, it is in acute onset. It is not a chronic facial palsy, it is acute onset. The patient will have a sudden weakness of his facial muscles. Along with that, it will be an element facial palsy. Element facial palsy, which is unilateral and idiopathic. It is the most common cause of facial palsy, and which is the most common site of insult. It is the labyrinthine segment. First of all, let me draw the mid-layer for you. This is the posterior wall of mid-layer that you see here. Then you have the medial wall here. Okay, and this is the anterior wall. Okay, and then let me draw the facial nerve. This is the facial nerve. Here it is the genu of the facial nerve, then the tympanic segment. Then you have the mastoid segment, after which the facial nerve exits through the stylomastoid foramen. Okay, so this area, which is the labyrinthine area, is the area of insult because it is the area where there is the smallest diameter, that is 0.68 millimeter. And so, practically all the branches of facial nerve are getting affected. That is, the greater petrosal nerve, which is responsible for lacrimation, is getting affected. Then you have the nerve to stapedius, which is responsible for innervating the stapedius muscle that is essential for acoustic reflex. Then you have the coda tympani nerve, which provides for the taste sensation coming from the anterior two-third of tongue. And all the muscles which are supplied by the facial nerve are affected. So there will be loss of wrinkling, wide palpebral fissure, which is causing epiphora, even though there could be decreased lacrimation and dry eye as well. Then absence of nasolabial fold and drooping of mouth with deviation of angle of mouth to the opposite side can also occur. In most cases, there is history of virus infection. An upper respiratory infection may be present within the past few days. Okay, and the most common virus implicated in causing Bell's palsy is herpes simplex virus. Even though this Bell's palsy is said to be idiopathic, viral infection is seen in more than 60% of Bell's palsy cases. Okay, and autoimmune etiology also has been postulated to cause Bell's palsy. Family history is present in more than 10% of the cases, and it is supposed to be due to the genetic predisposition to narrower facial canal. Pregnancy and diabetes mellitus can also predispose to Bell's palsy. The prognosis is worse in the elderly, but it is most commonly seen in the age group of 50 to 60. So, what are the etiology of Bell's palsy? Bell's palsy etiology include, first of all, viral infection. Then it could be vascular, or it could be autoimmune, or it could be a combination of all these. That is, first of all, there is a virus infection, and against that, the immunity is activated, and that is resulting in autoimmune attack. And this autoimmune attack, when it is occurring in the blood vessels, it can result in vascular etiology. It results in ischemia, which can be primary and later secondary. Okay, so these are the various etiology. Along with that, there is a family history in few cases. So these are the etiology of Bell's palsy. Central causes like stroke has to be ruled out when there is weakness of the limbs, and to differentiate between upper motor neuron lesion and lower motor neuron lesion, you can assess the wrinkling of the eyebrows, which will be absent in case of lower motor neuron palsy. And other element facial palsy causes like the Ramsay-Hunt syndrome has to be ruled out, and in Ramsay-Hunt syndrome, there will be deafness associated with vertigo in some cases. It may not be present in all cases, but yes, when there is vertigo and deafness associated with it, you have to suspect Ramsay-Hunt syndrome. Who was a celebrity that was affected by Ramsay-Hunt syndrome recently? He is none other than Justin Bieber. He had uploaded a video of his own explaining his condition. And you can clearly see the uprolling of eyeball affected by the facial palsy. Okay, this uprolling of eyeball when it is occurring in lower motor neuron facial palsy, this is known as Bell's phenomenon. It is seen in Bell's palsy as well as other causes of lower motor neuron facial palsy. And this Ramsay syndrome is caused by the herpes zoster virus, and it is also known as herpes zoster oticus. And because of that, there will be vesicles in the area supplied by the sensory branch of facial nerve. The other differential diagnosis to be considered is the Lyme's disease. It is caused by Borrelia burgdorferi and it is transmitted by ticks, and there will be this clear rash, erythema migrans, seen in people with Lyme's disease. And so you have to consider Lyme's disease as well, because this is one cause of facial palsy that can be treated with antibiotics and it is fully reversible. How will you treat a case of Bell's palsy? First of all, you have to treat them with steroid, and prednisolone is preferred at a dose of 1 mg per kg per day. This is tapered over 3 weeks. Okay, it is given for 3 weeks. And then you have antiviral drugs. What are the antiviral drugs that are given? Acyclovir can be given, or ganciclovir also can be given if the patient is presenting in less than 72 hours. Okay, because of the high probability of viral infection causing Bell's palsy, you can give acyclovir as well. And in more than 90% cases, there will be full recovery. If it is partial facial palsy seen in the patient, it will have a full recovery. And after giving steroid and acyclovir, is that enough? There should be care of the eye. Okay, how will you care the eye? There should be some kind of bandaging over the eye before going to sleep, and you can ask the patient to wear cooling glass in the day, because there could be exposure keratitis. Okay, to prevent exposure keratitis, you will have to use some drops. Okay, what are the drops that are used? You can use lubricant eye drops. Okay, that is refresh eye drops, which is artificial tear. Okay, artificial tear, that is methyl cellulose is given. And also you can put this tobramycin antibiotic eye ointment at night before eye padding. Okay, and along with care of eye, another thing that has to be done is physiotherapy. Strengthening of the facial muscles by various exercises like blowing the balloon or candle has to be done, along with facial massage as well as nerve stimulation. Giving neurotropic drugs like vitamin B complex may also be done, even though there is no evidence which suggests that it helps in recovery of Bell's palsy. Facial nerve decompression by middle cranial fossa approach can be done if the electroneuronogram shows more than 90% degeneration. So that's all for Bell's palsy. I'll be coming with another important topic. Until then, goodbye.